Hi everyone, I'm Dr. Wendy Sweet from MyMenopause Transformation, and I'm just having a little shout out to you. For those of you, wherever you are around the world, I just wanted to say hi. Thank you for being part of the MyMT community. I hope that you're enjoying my articles each week and that you can go back and read a lot of them. I'm busy focusing on heart health this week in my coaching community. I have well over 1,500 women in there from around the world, and boy, do they keep me honest. We talk about a lot of things, but every week in my coaching community that sits alongside my 12-week program. So every week or two, I have a different theme. And one of the themes I'm focused on for the month of July is actually women's heart health. It is the most kind of unspoken issue for us as we come into midlife and as we transition through menopause and into post-menopause. And I became very interested in this particular area because of my doctoral studies, and of course I was reading so much about the different risk factors that face women as they come into through menopause, and which of course is our reproductive aging, and then they go into post-menopause. Now we hit post-menopause around about 51 to 53 years old. That changes according to whether you've had a late puberty or perhaps you've had children a little bit later in life. Some of you will have gone into surgical menopause, so that's different from a natural menopause. But anyway, we go into post-menopause, which is really our trajectory to our aging years. And one of the main changes that occurs as estrogen naturally declines is that we lose some of the elasticity in our blood vessels. Now, this is well known as vascular stiffness, and I talk about this a lot in my articles. It's why many of you are promoted to have magnesium supplements. It's why many of you end up with changing blood pressure and perhaps changing cholesterol as you come into your post-menopause years. So we need to be very careful about this aspect of our lifestyle and of our health, I should say. And of course, I'm very interested in what are the things that we need to put into place to enable us to stay healthy as we get older. And one of those things is around changing our diet. In the My Menopause Transformation 12-week programs, I'm not a naturopath or a medical doctor, so I don't interfere with any medications or supplements that women are taking. But I'm really interested in and really focused on you changing your lifestyle to adapt to this age and stage of life. It's really important for the next 20 or 30 years as we get older. So in terms of our managing our blood pressure, in the program I talk about the nitrates that are found in beetroot and celery. Those are two vegetables that we can really focus on. And we can focus on aerobic exercise. I follow the work of Professor Hiroshima Tanaka, and he's a world leader in looking at reducing vascular stiffness when it comes to older, as we come into post-menopause. And I also follow the work of world-renowned woman's cardiologist, Dr. Angela Mars from the Netherlands. I'm having a bit of a focus on some of her work in the coaching group this week, and we're really focused on high blood pressure and how we can reduce that, because one of the things as we go into our mid to late 50s is that a lot of women are still getting hot flushes and night sweats despite some taking hormone replacement therapies or bioidentical hormones, and they're going, gosh, well, why is that? Why am I in my post-menopause years and my symptoms are still happening? And one of the reasons for that is this the changes to our blood vessels and our heart and we get reduced elasticity in our blood vessels. It's a very well-known phenomenon, and it's called vascular stiffness. So of course it's really important as we get older to do things in our really watch our diet and look at our exercise and try and reduce the severity of that vascular stiffness, which is just one of the things that happen as we age. It's a little bit like, inside us, our body is aging and changing. So think of those blood vessels as kind of getting, varicose veins on the inside. So we can do things to help to reduce our blood pressure and improve our health as we age. And that's what I focus on in the My Menopause Transformation Program. So if you haven't done my masterclass, my 2-hour masterclass, there's only a small admin fee because I host you in my coaching group area. So come and listen to that if you need to. And if you are in post-menopause, then because you're on the database, then please do check your emails or your junk mail if it's gone in there, because I've taken $100 off the price of the weight loss program for you if you are in post-menopause. And July is post-menopause month, so I'm going to have a few articles that focus on the last of the baby boomers, that's me, and certainly the first of Gen X. So women over the age of 53, 54, if you are going into your post-menopause years where your periods have stopped for a year or more, then come and join me on the Transform Me Weight Loss Program if that's a program that you'd like to discover as part of the My Menopause Transformation programs. So I'm Dr. Wendy Sweet from My Menopause Transformation, and my PhD is in women's health and aging. And over the month of July, I'm going to have a focus on heart health. So I hope you can join me at some stage.